Thank you.
Can we call the meeting to order? Madam Clerk, we're here for the Environment Education Committee, and today is November 2nd, 2016. Call to order.
Calling the roll, Ms. Simon.
Here.
Ms. Brown. Ms. Brown is absent. Mr. Jones.
Here.
Mr. Schrein.
Here.
Mr. Brady. Mr. Brady is absent. There is a quorum. Also like the record to reflect that Councilman Miller is in attendance.
Thank you. Any public comment related to the agenda?
No, Madam Chair, no one is signed in.
And so we have minutes from Wednesday, October 5th. Can I have a motion to approve the minutes?
So, second.
All in favor? Aye.
Aye.
Okay, minutes are approved. We'll move into our first resolution, 2016-0199.
Resolution number 2016-0199, authorizing an amendment to agreement number 140087 with Educational Service Center of Cuyahoga County for fiscal and administrative services for the Help Me Grow Bright Beginnings Home Visiting Program for the period 7/1/2014 through 6/30/2016, to extend the time period to 9/30/2016, and for additional funds in the amount not to exceed $470,438.
Thank you. So we have Bob Stape here from Invest in Children, and just
Good afternoon.
good afternoon.
Bob Stabe, Associate Director of the Invest in Children. Thank you for this opportunity. Ordinarily, we would have invited our partners to send representatives. We gave them an early dismissal today because of a game. However, I'd be remiss if I didn't, on their behalf, thank you and thank this committee. Our partners appreciate the support very much and are very grateful for it, and thank this committee. I'd like to spend just a couple minutes talking about the Bright Beginnings program, and then specifically talk about this amendment, and then I'll take your questions. So, a tiny bit of history. Almost 10 years ago, the state funded a Help Me Grow Home Visiting program, which was for high-risk moms. The idea was to help work to prevent abuse and neglect. And Cuyahoga County supplemented the state funding because we saw a greater need here. Well, that situation is completely reversed at this point. As of 2009, the state began cutting back, and now we get nothing from the state. The state does still operate a Help Me Grow program, but it's very small, very narrow eligibility, and they contract directly with the provider organizations. So to fill in the gap, we have the Bright Beginnings program, and this amendment supports that program. To talk a little bit more about it, this program, you can see from the map there, we serve families throughout the county. Last year, through state fiscal year 16, 669 families representing 900 children were served. Age range is prenatal up to kindergarten. And where it says here, at-risk families not eligible for home visiting, that means the state Help Me Grow Home Visiting program. One of the things that you do if you want to ratchet down eligibility is you can lower the age. So while we were doing intake up to 3 years old, the state program does intake only up to 6 months. So if a child is 7 months old and they're in a risky situation, the state home visiting program won't serve them. Little bit, just a few more statistics there at the bottom. Those are some of the risk factors that the program addresses, and some statistics. Some families reflect more than one of these risk factors, so it's not a duplicate. It's a duplicated count. The curriculum used by the Bright Beginnings program is called Parents as Teachers, and I won't go through all of these. Pretty much all common sense things. I do want to just call your attention at the bottom of this slide. Our goals: increase parent knowledge of early childhood development and improve parenting practices, provide early detection of developmental delays and health issues, which is very important, prevent child abuse and neglect, and then increase children's school readiness and school success. So those are the 4 primary outcomes that we look for from this program. Little bit about some of the other issues that are addressed through the home visiting program, and here's a list that you'll see. We cover maternal depression. Every mom gets an Edinburgh, which is a maternal depression screen. Lead poison, of course, is an issue. Immunizations, early literacy, safe sleep. Early intervention refers to working with families if the child appears to have a delay And then at that point, Bright Beginnings refers to the State Help Me Grow program, where they'll do a more intensive assessment to see whether the child actually does have a delay. And then the transition to preschool and Head Start.
Can I stop you here
Yes, you may.
about the lead screening? Is that done, is that screening the children if they have some connection to a lead paint house? I mean, what do you do with that?
The home visitors facilitate that, and facilitate it. They don't actually do the finger stick, but they facilitate the mom having the child screened. And yes, it is based on the condition of paint in the house and also geography throughout the county. Some communities were just not worried about it. Others were very worried about it.
So people who do the visit look around the environment and see if the child might be susceptible, and if so, they do a screen.
They look for a lot of things. I mean, they look
Gotcha. I know, but-
pets, firearms. Yeah, I mean, they do a pretty comprehensive assessment.
Sorry.
That's pretty much all I was going to say about the program. In terms of this amendment, the reason we're coming forward with amendment was because a portion of the funding that came to the Bright Beginnings program was state funding that came through the Ohio Children's Trust Fund. That's been discontinued. There's an ongoing issue now at the state where they're looking at realigning that funding. And anyway, our program took a hit. So we initially proposed a smaller amendment that would have taken them through the end of June. We worked through with the law department. They said, no, we want to kick it out 3 months and give them 3 months more funding. So that's where the $470,000 total comes from. One last point, the executive specifically wanted to refer this measure to council because he knew that council supported this program and wanted him to be aware that this is another instance where the county is having to fill a gap created at the state level.
Questions? Councilman Miller.
First of all, where it says it's to provide fiscal and administrative services, I presume this money also pays for the actual services themselves. Is that?
Councilman, yes. In fact, it's entirely, we don't craft that language, so it's entirely for the services. It all goes to Bright Beginnings, and then they in turn contract with a number of community-based agencies.
I've seen this before, and I think that language is odd.
I do too.
Yeah, so maybe the law department could pass that message up, and that could be looked at. What's the source of funding for? Is this money that was in our budget, or is it something additional that we didn't budget for?
This is Health and Human Services Levy funding that is in our budget each year.
Okay, and also for the committee's benefit, since I'm on the Regional Child Abuse Prevention Council, I'd like to bring to everybody's attention where that stands. We are required to submit a 4-county prevention plan on November 15th, and we're on schedule to do that. And we completed a needs assessment. It was completed a couple weeks ago, and actually the first draft of the plan came out today, and we're going to be applying for something like $1.1 million or $1.2 million over 18 months. So if we get what we're applying for, it could bring in at least as much money as we were getting from the trust fund, or perhaps a tad more. But it's entirely an open question as to whether it would be funded through county programs, or there's going to be an RFP process, and the county could apply, private providers could apply, and we don't know yet exactly how that's going to shake out. And in terms of what we're focusing on, we're focusing on basically a lot of the same things that you identified in your four parts. Plus, we're emphasizing parental resiliency, and we're emphasizing developing support networks and this peer-to-peer kind of programming, and we think the Family and Schools Together program is a very good example of that model. So that's basically where we're at. And when we submit this to the state on November 15th, believe it or not, they have a meeting scheduled for November 17th, and they're claiming that on November 17th they're going to decide on the funding allocation.
Councilman Miller, this is not, I'd like to finish up with what the amendment is before us, and then you have time at the end if you want to talk about what your committee's doing, because I
Okay,
want to
well,
stay focused on the resolution.
Okay, well, that was basically it.
Yeah.
Just to say, believe it or not, they're saying they're going to decide in 2 days. So we'll.
Okay, we needed to just focus on, I appreciate that work, but that's a separate issue altogether, right? In terms of you're applying for funds from the state with a separate entity.
Well, the director had talked about that the state had created a gap by discontinuing the funding through the Ohio Children's Trust Fund. I was just making the point that hopefully through another mechanism that they're putting in place that in some fashion we'll get that money back.
I don't know.
But that
I don't
remains
know.
to be seen.
I have no idea. If that happens, then we'll come back, but thanks for that. Any questions on the amendment? Councilman?
What was the dollar amount for the contract from 2014 to June 2016?
I'm going to call a lifeline. Marcos? This is Marcos Cortez.
I don't have the exact dollar amounts, but it was about $2.1 million over the 2 years.
I'm sorry, can you say one more time?
It was about 2.1 million over 2 years.
Okay. So this is in line, the 3-month addition is in line with the original contract amount?
Correct. And following closely on the heels of this amendment, we will have a contract for the balance of the 2-year period that will be coming back before the committee.
Okay, thank you.
Did you anticipate that the state was going to continue to fund this through the end of the year? Or you're just coming before us now because you want to continue to provide this service? I'm not sure. Our contract ended in June of 2016.
Our intention was to come back with a contract that started on June 1st and went through the 2-year period. It was the law department that guided us in this direction to say, no, we want you to amend this contract to add to fill in the gap from the Children's Trust Fund, add 3 months of funding, and then have a new contract that starts October 1st.
Why? Can I have somebody from the law department tell me why this is?
It was Anka, right?
I believe it was.
Anka Davis who worked on this for us.
Yeah, I'll look into that. I don't have the specifics on that, so.
Voting on this, and we've always operated on these 2-year contracts, and why the law department wouldn't come to the committee even to say they're doing this is curious. I don't understand now why we're on a 3-month retroactive assent to this money allocation is a bit curious to me. So I'm hearing from the director that we wanted to continue on with these 2-year contracts.
Correct.
And you were told by the law department that you shouldn't do that.
No, the original amendment was to add the funding to make Help Me Grow whole, because they were short because of the funding reduction from the Ohio Children's Trust Fund.
Okay, so you learned that when?
We learned that towards the end of this contract period. So we worked with our provider who informed us that they were going to be short some funding. We had a subsequent meeting with our our Office of Budget and Management, and informed them of this. They said it would be okay to utilize some funding to make them whole. By the time we had figured all this out, it was towards the end of this contract. We put forward the amendment to the law department. By the time it would have gone through, it would have been beyond the contract period. So they don't want to amend a contract that's already expired. That's what they told me. So they asked us to increase the funding for the first 3 months, include the funding for the first 3 months of the year, along with the additional funding. So that's where we got to the $470,000. Originally, the amendment was only going to be $153,000, just to cover them through the end of June. So now we go through the end of September, including the first 3 months of this current program
Okay,
year.
so you were anticipating a 2-year contract in the summer, early summer, and you did not anticipate that the state was going to totally cut off funding? Or did you anticipate that that was happening? Were you forewarned?
We knew that the state was cutting funding. We met with OBM prior to the end of the contract, said we want to, the Bright Beginnings had offered some incentive payments to their providers if they met their engagement goals and their number of home visit goals. The providers had met these goals, but because of the cut, Bright Beginnings said to their providers, sorry, we're not going to be able to pay you these incentives. So we talked about that with them, and then we talked with OBM, and we said, no, we can, based on what OBM is telling us, we can make you whole. We can amend your contract to provide you with additional money to get you up to June 30th, and then we'll start your new contract on July 1st. When we approached the law department about drafting that agenda, they didn't like the idea that we would be, as Marcos said, amending a contract that was about to expire. So they wanted us to extend the time, add additional money to cover these first 3 months, and then have a new contract start. The contract that starts October 1st is already in the works. And in fact, it will be introduced at next Tuesday's council meeting. So it's following this closely behind this one.
Any questions? Okay. So this is something we have to probably move on second reading suspension.
Thank you. Yes, please.
Okay, so I have a motion that we refer this resolution to the next full council meeting under second reading suspension.
Second.
All in favor? Aye. Any
Aye.
opposed? Okay, so thank you. We'll expect that contract coming next. And are we going to see then that it changes because of the lack of funding from the state is going to exceed what we originally budgeted for next year?
No. We've worked with Help Me Grow to make sure that they've been able to meet their expenses with the money that we've got budgeted.
Okay, thanks. Next item, can you read it, Madam Clerk?
Resolution number 2016-0200, authorizing an agreement with Alcohol, Drug Addiction, and Mental Health Services Board in the amount not to exceed $1,339,104 for the Early Childhood Mental Health Program for the period 1/1/2016 through 12/31/2017.
Thank you. Moving now to our Early Childhood Mental Health Program. This is a partnership with the Adams Board. They're our lead agency on this particular program. They in turn contract with 6 community providers that we'll get to in a minute. The program is funded jointly by the county and the Adams Board, and combined with our amount, it's about $1 million a year that goes to cover children who wouldn't otherwise, whose services wouldn't be covered by Medicaid, and that's primarily because Medicaid doesn't cover mental health services for children under the age of 3, and yet, as we know, children under the age of 3 do have issues. In 2015, the program served 433 children through the consultation component and 721 through the treatment component. Here are the list of our agencies, so you'll see who they are and where they're located. And then, so I mentioned a moment ago, there's really 2 components to the type of intervention, the type of work we do with the families. There's consultation, which is a short-term interaction. Sometimes it doesn't even involve the child directly, but it might involve the parent, it might involve the preschool teacher. And I'll talk about that in a second. And then we have a more in-depth home-based treatment where the therapist actually works with the family and the child over multiple sessions towards an agreed-upon treatment goal. The program has been evaluated by our colleagues at CASE, so we have a statistically significant decline in behavior problems and a significant increase in parent-child relationships. So let me talk a little bit more about the difference between consultation and treatment. We created consultation 2 years ago to address situations where the family was experiencing a short-term problem that could be easily resolved. We've been plagued with issue of waiting lists, and one of the things that we were able to do was to kind of triage cases. So in instances where the parent maybe needed some coaching or needed some advice on how to handle a behavior problem, we'll address that with the consultation piece of it. If it becomes clear through consultation that that's not going to be enough, then that child gets referred to the treatment component. But it has been able to provide a real positive impact on some families, and it's enabled us to address our wait list issue. So then for families needing a little bit more intensive work, we have the in-home treatment. We use evidence-based approaches. I've listed a couple here. This is parent and child interactive therapy, trauma-focused cognitive behavior therapy, and also child-parent psychotherapy. Plus there are others. These are really more therapeutic treatment approaches with the children. Frequently, I mean, it's not uncommon that we're working with children who have been exposed to trauma. They've been the victims of violence or witnessed violence. So we may, even in very young children, may be dealing with some very serious kinds of issues. Lastly, a couple recent developments. We work with the Adams Board to use a competitive process to choose these community agencies. They hadn't been, so we tried to be a positive influence. So the agencies that I showed you up front, they were chosen for a 2-year period. That ends in December. We've just concluded, the RFPs have just come in for the next 2 years, so we're going to be reviewing those to make sure that those are chosen competitively. This last year, we also implemented a new assessment for the children. It's called the Devereaux Early Childhood Assessment, or the DECA for short. So we've implemented that across all of the agencies so that they're using a consistent yardstick, so then we can use that data for our evaluation. They're certainly free to use other kinds of assessments, and many of them do, but they're all using this one, so we have an apples to apples comparison.
Just if you could send Janine all the slides so that we can have your presentation.
I've saved them to the desktop here. Yeah.
Thank you.
I do have a question about the timing of this period that began in January of this year, and why are we here?
Yeah.
And this is not an amendment to a
Be happy
contract,
to-
it's the actual
Yeah.
contract.
Be happy to talk about that. So one of the things that changed, under the old system, we had the individual agencies conducting a different assessment. It was the CBCL, the Child Behavior Checklist, and then they were sharing the data directly with us. So we had data agreements with each of those provider agencies. We were getting the data. CASE was getting the data. It was able to do the evaluation. We shifted to a new model using the DECA. At this point, the Adams Board became the license holder for the DECA. It's a web-based assessment, so the providers were entering the data into a web-based system that now the Adams Board controlled, And then their HIPAA compliance officer got involved and said, no, we're not sharing this information with you. So we've been shooting it out with them essentially for 9 months. We ended up getting our law department involved, Sarah Kamek, and even at one point, Director Priazzi. We got Case Western Reserve's law department involved because they really know more about HIPAA than the Adams Board did. And the good news was we finally came to a resolution. We were able to write language, craft language that will allow them to share the data with Case without, be able to share the data with Case so that we'll be able to get the results and know how our children are doing.
So we're not able to get the raw data, we're able to get the conclusory,
No, we're going to get
we
the,
actually
what's
get,
the raw
we
data?
as the county?
Well,
Or just Case?
Case gets it.
No, that's
yeah.
what I'm saying.
Yeah,
So what
yeah.
does the county get?
We get
the data analysis?
and the roll up. Yeah, yeah. I mean, they're getting names and personal identifying information, which honestly we don't really
That's
need
fine.
and don't want to be custodians of.
Do you like this, and you're satisfied with the arrangement we have with this DECA thing?
Now I am.
Yeah, you are, now you are?
Now I am.
Now you are.
Yeah.
Whose idea was it to go on that system?
To go to, that was a collaborative decision. I
Mm-hmm.
mean, we were all in support of that. The DECA is the same assessment that we use in our universal pre-kindergarten program. So it was a win-win on for a lot of different reasons. It's a good assessment that helps the early childhood and mental health therapists, but then it also allows us to compare the program with our UPK program. So we're using that same yardstick across a couple different programs.
Thank you. Do you have any dealings with the prosecutor's office, or you only work with our law department?
We only work with the law department. No. I mean, the irony of it is the chief counsel of the Adams Board is a retired member of the prosecutor's office. It's a fellow named Dave Lambert. So he retired and is now working as chief counsel for the Adams Board. So he's their HIPAA compliance expert.
Thanks. Any questions? Okay, so yeah, I think we really need to get this contract approved.
Thank you.
So I'll move that this resolution be heard at the next full council meeting under second reading suspension.
Second.
Okay, all in favor, aye.
Aye.
Any opposed? Okay, this will be on the next meeting agenda, and we have one more.
Thank you. Appreciate it very much.
Can we have that read, please?
Resolution number 2016-0201, authorizing a contract with Starting Point in the amount not to exceed $600,000 for the out-of-school time program for the period 10/1/2016 through 1/31/2017.
Hello.
Hi.
Robin. Hi.
Good afternoon, Robin Martin, Family and Children First Council. And I'm bringing before you today our contract with Starting Point. We've identified Starting Point as our lead agency for out-of-school time. Starting Point completes an RFP with the state of Ohio where they are designated as the lead resource and referral agency for our region, which includes Cuyahoga County, Lake County, Geauga, and Ashtabula. In this role, they are required to help parents identify out-of-school time, but they also work with out-of-school time providers to fund services and professional development for the providers. So through this contract, they are basically a flow-through. We provide them with the funding. They do all of the RFPs to identify the vendors. They pay the vendors. So 93% of the funds is direct service back into the community for kids, and then about 7% goes to pay one Starting Point staff who is responsible for providing technical assistance for the database associated with this program. And this person basically outsources to the sites to help them understand how to put the information in so that we're getting good data reports. Case Western Reserve, through another contract, facilitates the data process. So to gather the data, we have the young people fill out a survey called the Developmental Asset Survey, which is put out by the Search Institute. And we're asking questions related to how are they feeling about their community? Do they feel safe? How are they doing in school? Do they have a caring adult in their life? Are they able to make friends? And we track the kids over time in terms of how they're doing on those measures. For the actual providers, we do another survey called the Youth Program Quality Assessment. And what we've learned in youth development is that our young people vote with their feet. So the program might have a great location, it may have a great setup, but if the young people don't feel welcome while they're there, they will not come. And so we actually survey the providers to do a self-assessment on how they think they're doing, and then we do outside assessments, and some of them are actually conducted by the young people to let us know if this is a youth-friendly environment. Are they using up-to-date curriculum? Do they feel welcome in the environment? And we put those two surveys together to figure out how our out-of-school time programs are running. In addition to out-of-school time, this contract also covers efforts to outcome database and the surveys and the cost of all of the surveys, professional development for the provider agencies. We run a tutoring program out of Cleveland Public Library. We work with the Office of Early Childhood on transition to kindergarten, and we run a full March into Kindergarten program that actually helps parents transition to kindergarten, because we found out parents are as nervous as our little kindergartners. And through that program, we provide information to the parents through 211 so they can call, because what we found out is most school districts have 5 common things that they need for kindergarten, but there may be 2 or 3 that are different. And so 211 has the couple items that are different so that when parents get ready to register, they already know what is needed. So it's one trip to the school or to the school board to actually do the registration. We have a college access program where we actually help young people with SAT and ACT prep courses. And we also have assistance for families for filling out FAFSA forms. We have a scenarios program, which is a language arts program where our young people write short poems and scripts. And the winner for the county actually has their story transitioned into a small movie that are actually on Showtime and Sundance in between the regular movie schedule. And typically the movies are around some type of issue that our young people are experiencing in their community. And then lastly, we provide the summer programming for the Closing the Achievement Gap schools. I would, I'm sorry.
My question is, why are we only proposing a 4-month contract?
We have been asked in all of the Health and Human Services offices for any contracts that are funded by levy dollars to have all of them in on December 31st so that we can get all of our contracts on a county fiscal year. And so you're going to see a lot of our contracts either coming forth to this group or to the contracts board, where we're ending them on December 31st and then starting new contracts that run January 1 to December 31st. So there will be another contract for Starting Point coming back before you in a couple of weeks that will cover them for January to December, and then all of our contracts will be on a county calendar year, consistent with our budget.
And why is this one ending on 1/31/2017 and not 12/31/2016?
A little pre-planning on my part, because I know how many contracts are going to come before you, and so I tried to build in a little wiggle room, because like right now with this contract beginning on October 1st, we have 1 month of no services for our young people. So I was going to ask if we could suspend second reading and go for approval, but we didn't want to have that happen again in January.
So, thank you. No further questions. I'll make a motion to move this resolution to the full council meeting under second reading suspension.
Second.
All in favor, aye.
Aye.
Any opposed? Okay, so the resolution will be at the next council meeting on the 15th, Madam Clerk? Yeah, we moved it. Okay, thank you.
Thank you, and
Thanks,
go
good to
Tribe.
see you. Yeah, we'll see. Miscellaneous business, I have none. Is there public comment?
No, Madam Chair.
Okay, enjoy the game, everybody. Meeting adjourned.
Jack?